And in the news, 5 people have been confirmed dead in a mine collapsed at Akoon, a mining community in Takwa. Their bodies have been deposited at the Takwa morgue. Here's Samuel Kojo-Brace's report.
The Akoon community mining is a major part of the Takwa community mining program commissioned by the president in 2021. Data available indicates that 4,887 persons worked directly in the mine. On September 13, there was a major accident. Dan, not his real name, is a miner at the Abasi side of the Akoon community mining where the accident happened.
We got to work but felt the atmosphere had changed. No one could say anything, so we hung around for a while. It was then that one of our people came to hint us of the extent of accident that has happened underground. And right in front of us, they brought 4 boys who had died, and we thought that would be all. But unfortunately, we heard more people were involved.
He alleges that those who died in the accident are more than have been declared.
What collapsed is serious. Someone had sent a gang of 15 who were going to bring their load to the surface. But those people cannot be accounted for after the incident. So none of the people who had gone there to bring their loads and their items survived, meaning there could be more people underground.
According to Dan, safety measures are in deficit in that part of the mine.
Boss, there are no maintenance. At Abasi, you can squat for a long while to get to your face. We all do squats before we get in there because there are no maintenance at the Abasi side.
So I'm here on a Tuesday morning to speak to managers of the Takwa mining scheme. We meet them giving safety briefings to the miners before the start of the day's activities. The general manager here, Mark, rejects Dan's allegations.
It
is true that where we have restricted workers not to go and mine is where some people went illegally to work. They unfortunately mined the pillar that supports the ceiling, leading to it caving in on them.
Unfortunately,
we got 4 persons who were injured. They were taken to Redeemer Hospital to be cared for, but unfortunately, 5 other persons lost their lives. This is the biggest fatality since we started.
Only one life.
He says they cannot hide the fact of the accident due to the high interest of the state in the operations.
I don't think I can condone such evil.
At the underground, it will be difficult to keep decomposed bodies there due to the stench they can emanate. It is even difficult to get oxygen underground, so keeping decomposed bodies won't allow people to work.
Yeah, but keep decomposed bodies underground and people can't work. It's not possible.
Mark says safety is one thing they don't compromise in the mine.
You mobilize and workers and you sensitize one.
We mobilize our workers and sensitize them on the need to adhere to the guidelines management give them in terms of safety. So it is unfortunate.
Now, 5 lives.
But what are the real numbers involved in this accident? I have been speaking with more people who work directly at the mine to get the real fact. One of them is Abdul.
Bodies there need down. There
are no other bodies underground because the day it happened, they removed the 5 bodies and cleaned the entire pit.
Mark, the general manager, reveals that to correct the defect at the Abasi side of the mine, they have closed it down for 2 weeks to ensure a safety audit and correctional measures are put in place.
My underground captain and the team inspection. Now by advice management.
Now we have to let our underground captain and his team go and conduct an inspection of the place to advise us on the steps to be taken before we open the shaft to mining again. In case things have gone wrong there, we need to correct them before we start mining. We will do this to ensure that this kind of accident does not happen again.
Any fatality.
Some of the workers here who work at the Abasi side of the Akoon community mining scheme are not happy the shaft is being closed for 2 weeks, but the company says it is necessary to avert the recurrence of the accident that has claimed 5 people in the mine. Police in Takwa say they also saw 5 dead bodies and 4 injured persons being brought out of the mine, but have begun their investigations to unravel the fact. For Joy News, Samuel Kojo-Brace, Akoon, Takwa.
Now, police at Kuntinase are on a manhunt for a 54-year-old man who allegedly inflicted multiple machete wounds on his 34-year-old girlfriend at Petinsa in the Ashanti region. He was afraid his girlfriend of 3 years, Lovia Osei, would ditch him. Lovia says she's living in constant anxiety and fear of being attacked by her runaway boyfriend. I am interior of our security desk reports.
The two lovebirds lived happily together for over 3 years, until September 16, 2023, when Lovia graduated from her dressmaking training. Tofo, a native of Manso Agresum, who lives at Awukudako near Accra New Town, sponsored Lovia through the training. He is said to have overheard some participants at the graduation ceremony suggesting the lady would ditch him. Lovia says her explanation and assurance of love for Kwabena did not yield results. The couple returned to the woman's Patrensa hometown last week Wednesday, 44 to attack the victim at about 12 a.m. with a kitchen knife he brought from Accra. She survived the attack, receiving multiple machete wounds on the fingers, stomach, ear, thigh, among other parts of her body. Lovia insists she had no plans to ditch a man who sponsored her to learn dressmaking.
He feared I would ditch him after my graduation because his friends had told him so. Those statements took better part of him during the graduation. So the following Tuesday, he went down to sharpen the knife. Unknown to me, that knife was meant for me. It is the same knife he brought to Kumasi to attack me with at about 12 a.m. after we've enjoyed meals together. He said he will kill me and end his life as well. He cut me multiple times in the hands, ears, stomach, thighs as well as fingers. They have all been sutured.
According to Lovia, the attack has left her in constant fear for her life.
Papa no nyefe na papa na yesenti no kwan bia ebefa so ebebobla no yebobobla enti ono ne yese nkasika na yenya no obeboa me na ka ato machine na ka yede aye container enam sa no de sika na adwane program na se no adofo amobeboa yese sika no na wa maso awode adwane se woti me akwabratu for baby biala wo bia a police for show nyambra sema wa baba bedime no police for show enti man ho kwa na ye nchew na se owu da won so waje wo de.
From Kumasi for Joy News, Ohim Interior reporting.
The Veterinary Services Department is worried about what it describes as public apathy among dog owners in vaccinating their pets in the Ashanti region. Regional Officer Dr. Mabel Abudu says her outfit is frustrated at the low patronage of vaccination from pet owners in a region that has recorded 4 rabies-related deaths in 3 districts since the beginning of the year. Another report by Ohim Interior.
Rabies infections usually occur following a deep bite or scratch from rabid animals. The transmission of rabies to humans by rabid dogs accounts for up to 99% of cases in Ghana. Though there's no cure for rabies, it can be controlled by vaccinating rabid dogs and infected persons. Health authorities say people infected with rabies in the Ashanti region, majority being dog owners who suffered dog bites, have all died. At least 15 deaths were recorded in the Ashanti region in 2022 alone. Achumong Bejanov, Bosomtwe and Ashanti South are some of the latest districts and municipalities to have recorded cases of the disease. Regional Veterinary Officer Dr. Mabel Abudu is worried despite ongoing sensitization drives. Some residents in the region continue to downplay the existence of rabies or claim to be fortified against the disease.
I am very, very worried because, one, people don't believe that the disease exists. People also believe that they come from certain tribes, therefore they are protected, even if they are bitten by dogs. And then people also don't see the need at all to vaccinate because they feel the animals. So I am worried.
Dr. Abudu spoke in an exclusive interview with JoyNews at rabies vaccination exercise in commemoration with the World Rabies Day at Jinyasi in Kumasi. She is urging the government to step up efforts to eradicate rabies by 2030.
The commitment from the government side is very slow, very, very slow. And so we become afraid, but we will not lose hope because we know there can be a change, a miracle can happen. Needed resources. We are here. If you give us everything that it takes, the vaccines, I'm talking about logistical support, everything, we'll be able to do our work.
Meanwhile, Dean of School of Veterinary Medicine at KNUST, Professor Benjamin Emekpe, wants all hands on deck to push for zero rabies in 2030, as he called on the public to desist from using concoctions to treat the deadly rabies virus. He spoke at a public forum organized for residents of Kontinasi in the Bosomtwe district.
We have done it before. With COVID, we are one of the best countries in West Africa that could take COVID. There is no doubt that we can do this again, and rabies should be a thing of the past.
From Kumasi for JoyNews, Ohimenteria reporting.
Now, medical officers are worried about the increasing number of polycystic ovarian syndrome (PCOS) cases recorded in Ghana. PCOS is a medical condition that reduces fertility in women. A medical practitioner at the Tema Women's Hospital and Fertility Center, Dr. Ya Usuba, said about 8 to 10 women are diagnosed with the syndrome weekly there. Now, speaking at an awareness creation event on the condition, Dr. Usuba has advised women to seek medical attention as soon as they experience symptoms.
Polycystic ovarian syndrome is a hormonal disorder that causes enlarged ovaries with small cysts on the outer edges of the reproductive system of women. According to the World Health Organization, 70% of women remain undiagnosed of the condition. PCOS has been identified as the commonest cause of anovulation, a leading cause of infertility in women. In line with a vision to promote good reproductive health and to end infertility stigma against women, HOSE Ghana, a non-governmental organization which advocates women empowerment and child protection, held a PCOS awareness seminar to sensitize women about the condition and the importance of creating a supportive environment for persons living with the condition. A gynecologist at the Tema Women's Hospital and Fertility Center, Dr. Ya Owusuba, outlined some causes and symptoms associated with PCOS.
PCOS stands for polycystic ovarian syndrome. So it's basically an imbalance in your hormone levels. So every month, the hormone levels need to increase and decrease in your body in order for you to menstruate. But in PCOS, the hormone levels are off. So it causes menstrual problems. Sometimes women will not menstruate. Sometimes they'll menstruate irregularly. Sometimes they menstruate abnormally.
A journalist and gender advocate who also doubles as director of HOSE Ghana, Emilia Na Ayele Ai, called for support for women with infertility issues.
Society should rather look at what is causing the delay or what is causing them, what is preventing them from having children, than stigmatizing them. So I feel women should not be stigmatized, women should be supported.
A patient, Priscilla Asante Kwache, who has been living with PCOS, shares her experience.
Experience is not a good one. Initially my menses was not regular, and then sometimes you get depressed, emotionally as well, because you don't know why it's not coming. But because I knew, I wasn't bothered initially because I wasn't even married. But then they were giving me medications to manage the situation.
It is hoped that this seminar and many others will contribute to a more inclusive society for individuals living with PCOS. Linda Enyan's report read to you.
Now, Ghana's ambition to eradicate poverty under the Sustainable Development Goals may not be fully achieved, as many beneficiaries of social protection programs do little to demand better livelihood support from government. The Civil Society Platform for Social Protection Ghana is re-echoing the need for Ghanaians to appreciate their entitlement to programs under the government's social protection policy. They believe the approach of seeing the policy as a right and not a charity would facilitate poverty eradication in the country by 2030. There's more on the following report.
Under the National Social Protection Policy, the government of Ghana constituted a framework in response to vulnerability and poverty. 5 programs, including the Ghana School Feeding Program and the Livelihood Empowerment Against Poverty (LEAP), are to guarantee relief for a section of the Ghanaian population. Civil society organizations are citing the lack of insight into concepts underpinning the policy as a major reason for the ineffectual rollout of the programs. Christiana Bedema, a social policy specialist with the United Nations International Children's Emergency Fund.
One of the things that can help us is to also empower the demand side of social protection, because with the supply side, government is doing its best, but the people who are receiving the benefits, they must also understand that they are entitled to those benefits, because that changes the narrative. If you know that you have a right to something, you are entitled to it. The way you approach it is different from when you feel that it's a charity, it's a gift, you're not entitled, it's a favor that somebody is doing to you. And if you think it's a right, you approach it in a different way. It changes how you even provide feedback on the program and how you see things. So with the Rise campaign, we want to empower our citizens, Ghanaians, people who receive social protection programs, that these programs are there for them, and the government has a duty to respect, to promote, to protect, and fulfill this right.
Available data suggests that over 2 million Ghanaians live in abject poverty as of 2022. Under Ghana's $3 billion IMF bailout, the government has committed to expanding the LEAP coverage to all 2.5 million extremely poor individuals by 2024, as estimated by the Ghana Living Standards Survey. Stakeholders believe the target could only be achieved if the government prioritizes social protection as a right of the people.
We've also gone into the IMF program, and for 3 years, a lot of commitments have been made by the government. It's also very important that after the 3 years, what happens? So the government has made commitments for the social sector, especially the LEAP cash transfer and other programs, to make sure that they protect funding for those programs. But after the 3 years, what do we want to see? We want to see this continuous commitment for the sector. And how will government continue to see this as a priority? Is if they see this as a right for Ghanaians. They realize that it's a right they must fulfill, they must promote, they must protect at all times, with or without the IMF program. So that is why this is important, and the atmosphere is very conducive for this campaign.
In Ghana, street begging is an unmistakable sight to behold, despite being an unlawful practice. The CSOs are partly attributing the seemingly unending begging habit to reduced implementation of livelihood projects to support genuinely poverty-stricken individuals. Oberon Jalil Odum is with Inclusion Ghana.
I think that one, they don't know that this is a right, and so they cannot claim it. Obviously, if you know that there is an intervention by government, it means that you can actually submit yourself to be assessed so that you can benefit from it. But many people don't know this. And so I think that critically, what government should do a lot more is to make sure that they are communicating the programs to the general citizens. People want to know, people must know, and people should know.
For JoyNews, my name is Emmanuel Bright Kweku.
There's been an alarming increase in mobile money fraud, and Cybercrime Deputy Commandant of the Ghana Police Academy, ACP Gustav Yankson, has revealed that the Cybercrime Authority records approximately 20,000 cases annually. The security personnel was speaking at the 12th Dewona Hammond Memorial Lecture held by the Winneba Secondary All Students Association.
The Cyber Security Authority also receives cases, and it recorded 11,000. I think as of 2020, they had recorded almost about 20,000 cases that they have received. And FIC, that is also looking at our cases, any suspicious transaction around any bank account. They are also following it up, and this is the statistics they put it out from 2015. They put out there from 2015 to 2019. And you can see that a total of about $343 million where they raised issues concerning this account, and it's related to cybercrime. Momo has also been another. The police has received a lot, and then I think Bank of Ghana was also out recently saying that the cases reduced, but the amount involved had increased to 27 million Ghana cedis just for 2022. These were the cases that were received from the cybercrime unit from 2016 to 2021. We have not seen any decrease up until 2022. Fraud is always number one in Ghana. What it means is that as a people, we are very gullible, because fraud most often goes with people trying to deceive you. So if that is number one case, and I gave a press release some time ago that almost about 45% of our cases are related to fraud.
And that will be all for the news on the AM show. We'll be back with more exciting discussions. Please stay.